Good afternoon to you. I hope you're all doing well, and then your weekends is fine. So, I did some issues from last week that you want to seek clarity to or input. Let's spend a few 2 minutes looking at it, and then we'll look at then we can look at the today's lesson as planned. Is there anybody who had issues upon revision of last week's lecture that will require clarity, or you want to make a contribution to last week's lecture? You can do that now. And if there is none, then we'll go ahead to look at today's lesson, of which we shall be looking at the theories of leadership as well as the types of leadership, as was outlined last week. To discuss as far as last week class was concerned. Okay. So let's look at today's lesson and see what we seek to achieve today. So we are still on leadership, and we are looking at leadership theories and their styles. So we want to see classical and contemporary leadership theories. What are they? We want to look at leadership styles in terms of autocratic, democratic, laissez-faire, transformational, and transactional. We'll look at situational leadership in clinical practices. Then we'll look at effective leadership behavior in maternity care. What are they? What are the critical components of effective leadership in maternity care? So last week we took some time to look at what leadership really means, and then we were saying that it is the process that has more definitions based on the construct you are using, whereby because it's a social construct, it has no unique definition. Unlike a pragmatic definition of 1+1 will give you 2, leadership has its own construct based on what it is applied to. So within the clinical care, we say that what uh, while constantly influencing others to improve the care they provide. So our aim is to improve quality of care. And when we improve quality of care, then definitely we'll be able to we'll be able to enhance the outcomes of our patients. You understand what I'm saying? It's only in the provision of quality of care that we expect what? Quality outcomes. But if we do not provide quality care, then we should be also not be expecting what? Quality outcomes. All right. Then we are saying that leadership and management are critical component of professional what? Midwifery practice, meaning that for us to be able to achieve the goal of the maternity unit, leadership is a critical role which we have to look at. And then we say that every midwife is not just about providing care. We looked at that last week. And we agreed that yes, beyond provision of care, beyond catching of babies and then palpating women, there is a call to leadership role whereby we are expected to be managers and then we are expected to be leaders of the various teams that are operating under us. Then we say that for us to have effective improvement in maternal and neonatal outcomes, there must be what? Effective leadership. So we look at some of the concepts that brought about these effective leadership strategies. We said that when we talk of theories, we are talking about the foundations of a philosophy, the principal foundation of a philosophy, or the principal foundation of a what? An ideology is what we call a theory. So when we talk of classical leadership theory, we are basically talking about theories that existed before the that existed during the ancient days and then have been modified and upgraded to the level that of which we are practicing the contemporary leadership style. So classical leadership theories basically were theories that focus on leadership traits, leadership authority, and then the leadership behavior. So it influences the traits of the person, individuality, his level or her level of authority, and the behavior of that person. Now, it emphasizes on control and structures and efficiency. That is what the classical leadership emphasizes on. It more focuses on controlling and working within a structure. And it was developed during the early organizational and industrial periods of life. That's why I said that these were ancient concepts of philosophies that were used to guide our behavior as human beings and to identify people to lead us and guide us. So we said over the decade, many great scholars, researchers, and academicians have conducted various research and studies to discover that contribute to effective leadership. So in this process, the following fact so we identified significant theories. And these were the theories that we identified as what? Constructs of leadership. The first one was the great, followed by the trait theory, then the behavioral theories, then the contingency theories, then the charismatic leadership theory, transactional leadership theory, and then we have what? The transformational leadership theory. So when we talk about the great man theory, this was a theory that was proposed by one Thomas Carlyle in 1814. And he merely believes that leadership is an inherent trait of a person who is destined to become a great leader by birth. So let's say a monarch system whereby the prince by birth is meant to be the king of the kingdom in the absence of the father. And they provide themselves, they prove themselves when the great need arises. So by virtue of arising and sitting on the throne and after the demise of their father, then they also exhibit that type of leadership skill. Now, this theory had its own shortfalls, and one of the greatest shortfall was that it was a male-centric approach. Even though women had the abilities to prove themselves to be good leaders, it was such a way that if you were not a male, you were not presumed to be a leader. So leadership based on this theory was centered on males. So they will look for those characters out of the male. Then this theory also explained that leadership cannot be learned. You see, that's the principle. That leadership cannot be learned or cannot be taught. So because it is believed that you are born with it. And once you are born a leader, that's it. If you are not born a leader, you are not. Even if you go and learn leadership and management, but you can't come and lead. And this theory did not also have a scientific validation to support it. There were no scientific basis, there were no evidence to prove that it was valid. And it took to negligence the environmental and situational factors that influence leadership processes. So these were the shortfalls of the great man theory, basically about 4 shortfalls that made the system to put down that theory and say, no, this great man theory, even though it's good, but it doesn't work anymore. Then came the trait theory of leadership, which was proposed by Raphael in 1914. And his philosophy was that, yes, You can be born as a leader, but you must contain or you must exhibit certain traits within you inherently to now demonstrate that you're a leader. So even though you can be born the crown prince, you need to exhibit certain characteristics that makes you like a crown prince. And those traits were intelligence, confidence, integrity, emotional stability, and assertiveness. It was believed that once you were born a leader, a great man theory works in you. Those days, quote and unquote, the gods of their land will inculcate in you these traits so that you can exhibit them and climb your throne or your seat as a leader. But it has its limitations, and that limitation was just the same as the great man. Sorry, the power powering my table net, my internet went off. We had a light out, so the table net went off, so I got disconnected. But I think the light is back, so let's continue. So if you did not have those traits or those characteristics in you, then you were naturally ruled out of being a leader. That was what the traits and then the great man concept was all about. But within the nursing profession, we were not depleted of that construct when we assign some of our senior male people to leadership role based on their years of work experience and how old or seniority levels they have exhibited over us. So we used to have this thing called long service. And this long service was one criteria we used to appoint most of our cadet of workers. So we were by virtue of working for quite a number of years, you get promoted to some serious ranks, and then you can also acclaim to a seat and become a leader, and then you lead them. But this had its shortfalls. And the shortfall, as I said, was that it meant that apart from doing long service, you couldn't have been a leader. Meanwhile, we could learn to become leaders. Now, then came the behavioral theory, which was in 1950, a year, 10 years, a decade after the trait theory. And they were of the view that, yes, you may have personal traits of a leader, which are essential for a leadership's role. But what is the influence of what? The organizational what? Culture on the leadership behavior of the person. So how did they behave to ascertain or become assertiveness, become assertive to the environment or become assertive to what they want to be as leaders? So there were two types of studies that were conducted to assess the behavioral influence in terms of becoming a leader or a great leader. And one of them was the Ohio State University study that was conducted among the military camp people of the US. And it was observed that out of the many type of leadership demonstrated, people-oriented behavior and task-oriented behaviors were the two basic principles of behavioral leadership that were more centered around the personality of the person or the group of people that are being led, while the task-oriented behavior was being curved or manipulated or being influenced by the task or responsibility being assigned to those particular leadership role or expected of that leader in that capacity. Now, if you look further, the second study that was in the Michigan study also came out of the job-centered behavior, which showed that what the person lead based on the job description he or she was given to do. And then the organizational members interact, maybe behavior also looked at influence of the organizational culture and the type of members the person was leading. So if he's leading ABCD, he adopts ABCD strategy. And if he's leading CDEF, he adopts CDEF strategy. So this were the two constructs that inform the behavioral theory. But as we say, everything will always have its strength and weakness. And one of the strengths of the behavioral theory, which has allowed it to stay for long, is because it told us that leadership skill can be learned and improved upon. So it's an acquisition skilled process, meaning you can acquire the skill and not necessarily born with it. And then we can then say that thus as a result of this construct or this theory, we are having some leadership trainings being rolled out by institutions and universities and colleges as we are doing and as we are learning today how to become great leaders. It's because of this behavioral theory construct that has given us the opportunity to learn, to be trained to improve on our communication and supervision skills as leaders so that we can get the desired outcome in terms of what? Quality healthcare. Now, the contingency theory, which has to do with almost similar characteristics like the situational leadership, but it's more divergent on other constructs, other models, which I've taken time to elaborate in terms of pictorial, the influential construct or models on the contingency what theory, which says that what it is a theory of leadership that says that effective leadership comprises of all the three factors. So the three factors are you must have a trait in you, you must have the characteristics of a leader. Behavioral wise, you must be situated in a way that you can be a leader. And situational means you must have a purpose for that particular type of leadership you are bringing. So we said leaders' behavior varies as per the situations they find themselves in. So if you're a leader and then you are not having this three, then the contingency theory will tell you that you have a loophole in your what structure of leadership. But they believe that what there must be cognitive resource theory whereby they say that what there must be a balance between your intellectuality and then the resources available to you for you to achieve your goal. So that is the contingency theory. I do private time of your week to look at the 6 concepts that surround the contingency theory and also try to understand what they are and what they are made up of. At least it will help you in understanding these constructs better. Then we talk of the charismatic leadership theory. So growing up, we used to say, oh, somebody is charismatic. He's a charismatic leader. He's this leader. He's that leader. He's a charismatic leader. Today we are seeing it. And we are learning that it's a theory. It's a theory that believes that a leader must possess some extraordinary and exceptional qualities to become an effective leader. And some of such leaders lead by their key traits. And one of them is people within your scope. So we say charismatic leadership is a style where leaders use charm, strong communication, and personal magnetism to inspire in a way that end up also being motivational for their followers. Okay, and by so doing, they're able to articulate certain compelling vision that deepens what emotional connection between men during crisis. And one thing when I say it often emerge during crisis is a situational type of leadership whereby you are driven to, so it can arise at a point in time and disappear at a point in time. But the important things about them is that vision, they are visionary. So they are able to articulate a clear and a compelling future. So he has a vision, an ability to articulate clearly what he wants to achieve for that organization. They have this good communication skills, okay? They are high skilled, are enabling the ideologies and concepts and constructs, you know. So they can take any decision to whatever extent to make it what? Realize. Now, when you talk about this particular charismatic theory, you see, it's a socialist construct. And when we talk of a socialist construct, we are talking about a kind of construct that look at the social dynamics and the social influence in leadership. So Max Weber was the one who first described this type of leadership. And then his point was that it's a form of leadership that was based on extraordinary personal qualities. So it was about the personal qualities of the person, okay? And then he came out clearly to say that what if you exhibit these three conian shaped items, then you will automatically exhibiting a charismatic leadership within that particular time frame. So that is what the classical theories of leadership entails. So basically, we have looked at the 3 to 4 of them. We have looked at the great man theory. We have looked at the trait theory. We've looked at the behavioral theory. We have looked at the charismatic leadership theory. These are the classical leadership theories that we had. And then some are still in existence, others have been put aside. Each of them has their pros and cons, and I've taken time to elaborate on some of them pros and cons for us to understand them better and to us as an institution, as a healthcare provider, as an individual who has a family, who has a group, who has a team to lead and to facilitate. Let's go to look at what the contemporary leadership theories are and what do they speak about. So contemporary leadership theories basically are theories that focus on relationships towards the achievement of the organizational goal and vision and mission. They are also looking at how motivational their leadership style is upon their followers. And as a result of that motivational characteristics or attributes, the followers are able to buy into their ideology and to lead and to follow them towards the achievement of the goals and the aims of that particular organization. And not to talk about the full presence of adaptability of strategies among followers and leaders that will help both of them in achieving the organizational goal while fostering good teamwork and then what? Collaboration. So these are what the focus of the contemporary leadership theories are. Unlike the classical leadership theory that was more focused on the individuality characteristics of the person who is a leader. Either you are born a leader and that has to do with personality, individuality. Well, you are having those traits or inherent behaviors that makes you a leader, or you are having the kind of exposure that makes you a leader. But these contemporary constructs are all about beyond those personality, by looking at the social and the individual plays a critical role in your leadership style. Your leadership strategy will not work. So that is what the contemporary and the, and the classical leadership skills. So let's look at some examples that include what? Transformational leadership, transactional leadership theory, and situational leadership. Now, these three types of leadership theories are also leadership styles, SFP, underpinning the leadership style. So don't be surprised when you hear transformational leadership styles. And somebody's also saying transformation leadership theory. The theory exists, and out of those theories, the styles are being exhibited. So a demonstration of the theories are the styles that we have. So basically, we have about three critical ones we want to look at that functions effectively within our healthcare sector and within our various domains of work. It's either you are exhibiting a transformational leadership at a point in time, or you are adjusting yourself to a transactional leadership based on the circumstances around you, or you have whatever situation you find yourself in. Let's look at what each of these key components of theories look at. So when we talk of the transactional leadership theory, we say that this style of leadership is which the leader promotes compliance of his or her followers through both what? Reward and punishment. So transactional leadership theory is a theory that focuses on reward and punishment. You do the good thing, I reward you. If you do the bad thing or the wrong thing, I punish you. So that is the foundation of transactional leadership theory. Reward good things and punish bad deeds among your followers. So it focuses on the role of supervision, organization, and group performances. It has nothing to do with your personal traits, personal acquisition, personal relationship. No, it focuses on the job at hand, so that the person supervising you is looking at how are you doing the work in such a way that it is not affecting the organization. So if he or she find out that you are doing something wrong that does not yield to the desires of the organization, then they take drastic actions against you so that you don't bring the aims of the organization to ground. So you say that the most of the time they are more interested in identifying faults and deviation so that the organization does not deviate from its main aim and objectives. So we say that the transactional approach is task-oriented and can be effective when meeting deadlines and in emergencies such as when dealing with a cardiac arrest. So the cons of this transactional leadership is that once it is looking at reward and punish straightforward, it is task-centered. What you ask the person to do is what he's going to do. Because if he doesn't do that and he does otherwise, he's going to be punished. So these are people who follow rules and regulations as they are told. And we are saying that it's very effective when you want to meet deadlines, because you tell the person, do this before this, and that is done before that. Meeting deadlines are very important. So one other thing that it is also good for attending to emergency situation. But the problem is that if you are not knowledgeable in the area you are taking that decision, you may not be able to execute this principle. So we say this approach can lead to non-holistic patient care because nurses focus on the tasks they need to complete rather than the patient as a whole. So you've asked the patient, the nurse, to dress a wound on, observe that there's a blister on the other side. But because you have asked this patient to do, and you know that you are going to assess or appraise or reprimand him based on the task you have given, he will not even look and even try to address that blister issue. Meanwhile, this blister will eventually come back as another wound for dressing because care is not initially initiated. So instead of looking at the totality of the patient, you see that the person is just looking at what you don't get quality. Based on this criteria, transaction and these three main criteria, agency reward theory or construct under the transformational leadership is looking at whereby you reward your subordinate for doing what? A job, or for meeting what? A target. So the person only get reward when he meets a target or he achieve his goal or he fulfill the responsibility being assigned to him or her. Then you reward that person. We call that a contingent reward because you are rewarding the person in continuance to what the person has what? Has done. Then we have two types of management of exception. We have management of exception, management by exception active, and management by exception passive. A management by exception active simple means that you are a leader who has a subordinate and you know the shortcomings of that subordinate. So you already take actions to prevent that shortcoming of that subordinate from becoming a problem in your. You have a staff who is a perpetual late comer. Any shift you put this staff on, he will come late. He doesn't regard his colleagues because he feels that what? Maybe he is senior to all the other ones. So as a way of preventing him from continuing to be a problem in the world, you decide to add him to your shift so that you will supervise him. At this point, we are saying you are exhibiting leadership management by exemption, but active. Unlike the passive mechanism, the leader wants the resource, but he will wait till this person becomes a problem before he intervenes. So I give a practical example with our national road system. Sometimes there are roads that are, they know that the road from this place to this place is bad, but they are not doing anything about it. But the moment an accident or an unwanted outcome occur, a devastating impact is felt as a result of the bad nature of the road, you find them working on the road or trying to fix the road. And when it's like that, we call it management by exemption, passive. Meaning you are just passive about the what? Your responsibility as a leader and as a manager. So you only wait for the negative outcome to occur to become your basis for acting. Meanwhile, I expect you are required to act before the passive stage whereby the negative outcomes would have taken its effect. Then we look at transformational leadership. Behavior, transform and inspire expectations, transcending self-interest for the good of the organization. So we're saying that here the leader who is leading is looking beyond just having a working relationship you can do to enhance the what? The work. So he's looking at the dynamics of the how his behavior as a leader will transform and inspire his followers. We are also talking about the inspirational motivation that is involved in providing a vision for the future among what? Followers. So this leader is also part of a motivational program that is set aside to motivate staff in such a way that they go beyond, working beyond their expectations. So motivation is a key factor when it comes to transformational leadership. Inspiration is a key factor. And then we talk about the behavior of the leader herself being a key factor. So we say empowered followers possesses increased organizational loyalty, motivation, and job satisfaction, which reduces stress sickness levels because when the culture, the organizational culture is bad, then you have a lot of some few staff experiencing burnout and overload or occupational stress. Then you have more of them falling apart to respond to physiological needs such as sickness who may need treatment, but human resource, and you cannot talk of productivity at that level. So once you are able to empower your followers, then you motivate them well. Then some of these things reduces, and then you can talk about what positive work environment. They will say intellectually inspired followers. So transformational leaders intellectually inspire their followers. They identify the individual differences within among their followers and assist followers to develop their strength. And sometimes you find managers asking followers to do certain courses and programs to come back and fit in some particular positions and work for the organization to achieve what? A goal. And that is because they have identified the individual difference and shortfalls of those staffs and have decided that career progression will bring them back to work better if given the opportunity. And that is what transformational leadership is about. transforming your followers to become what you want them to be as an organization. So transformational leadership also has its four constructs. And the four constructs are authoritativeness, democracy, affiliativeness, and then what? Coaching abilities. So the first construct we talk about authoritativeness, talk about the ability of the transformed leader to mobilize people towards a vision. He has the strength to put together a team that will work towards a vision. And by so putting down the team, he also makes sure that he motivates this team and make sure that beyond the motivation, there's an impact they make on the vision of the organization. So he mobilizes them, motivate them, and by motivating them, these employees will also work to achieve what? The goal of the organization. Then they exhibit democracy. So he mobilizes these people, motivate them, but he just doesn't tell them what to go and do. He seeks their opinion, their input about whatever he wants to do with them. And as a result, he built consensus with them through what we call the participatory type of leadership. So they get involved in the roles of the leadership process. And then they now allow he who is the leader, who has some responsibility of accountability, you understand, to now make the decision based on their input on what to do next. Now, there is this affiliativeness of what? Membership to leadership. So they form this emotional what? Bond. By this constant interaction and seeking for the welfare of each other, they form this emotional bond. And they also offer positive feedbacks and a sense of belongingness to the organization and from the organization. So supervisors give their subordinates feedbacks, and these subordinates are also at liberty to give their supervisors feedback based on the output and the outcomes of their activities within the organization. Then we talk about team building, moral improvement, because that is one other thing that as a good leader, you have to be able to do to build a team. So once you mobilize them and motivate them, you must make sure that what they are able to work together. There should be feasibility of communication and compatibility with them as far as the objective they are trying to achieve is concerned. Then you have to develop people's future by coaching and mentoring them. And you have to do so by identifying their strengths and weaknesses and then helping them to formulate policies and guidelines and objectives that are geared towards the main aim of the organization. And one critical component of this, which I see common, is the staff appraisal process, whereby we appraise our staff based on their strengths, weaknesses, and opportunities that they need to embrace career path they need to follow, and how they have worked for the past, efficiency, punctuality, knowledge about our leader who does this. At the end of the day, you are also expected to transform the life of your subordinate, because after doing this assessment, appraisals, you're supposed to let the person know how to overcome his shortcomings and improve on his qualities as a worker under you, so that in the next year appraisal, those same errors will be improved and not repeated as shortcomings of the patient, of the client, of the subordinate or your follower. So that is the essence of appraisal systems, so that we will do better in our next system than just having to be what? Lagging behind. All right. So are there any questions so far before we go ahead to look at leadership styles and what it entails? Are there any questions about the theories and classical and contemporary theories of leadership, looking at the great man theory, the inherent trait theory, the contingency theory, and the behavioral theory for the classical theories? Then for the contemporary theory, looking at the transformational theory, the transactional theory, and then now we've looked at what? We'll look at situational theory as we go further. But based on this, are there any questions or comments or suggestions or clarity somebody will want to seek? Please, you can liberty to raise your hand. You can also share your comments at the comment section. Are there any concerns so far as today's lectures where we have reached? Are we okay? Or is somebody having a question or something? So whilst you organize your thoughts and mobilize yourself, let me take it 2 minutes. I'll be back. Okay. So let's look at the all right. So those who got off, they can try joining now, and then we'll continue. We'll lock it back just for some few minutes for them to join. And please, if you know your details are not properly documented, please do the needful. You just put in the iPhone this and telecell this and then Zoom user. I mean, please identify yourself well. If not, I'll take you off the class page. Okay. So let's look at, we have seen the theories. Let's try to now see what the constructs have become from the theories. What are the styles that are associated with these theories and how are they being what? Executed. So we look at the leadership. We look at the leadership styles. So we've looked at the theories. Let's look at the styles. What are they made up of? So we say the leadership styles refers to the behavioral approach employed by a leader to influence, motivate, and direct their followers. So that is a simple definition of leadership style. How the individual who is a leader has adapted certain principles based on the theories we have learned to help him or her lead his people towards the achievement of the common goal. So the leadership style determines how leaders implement plans and strategies to accomplish given objectives while accounting for stakeholder expectation. whilst accounting for stakeholder expectation. And then the well-being and soundness of their what? Followers. So if you look at the theories of leadership, you start seeing which of them are being implemented within our facility, because how your supervisor or your leader behave depend on how he has adapted one of these strategies of theories. So the major tenet of effective leadership style is the degree to which it builds followers' trust of their team. So how the is very important in terms of what the successful outcomes of that leader. If there is no trust, forget it. Your strategies will be nice, but they will not work because you will not get that support. So studies carried out indicate that followers who trust in their leaders are more likely to follow through with the leader's instruction over and above the expected what outcomes. So because there is confidence and trust, when the leader says do A, B, C, D, you are willing to do even more so that he or she will be happy with you and impressed with your output and your outcomes, because you trust that at the end of the day, your reward or your quota of what is due you will be given to you. Unlike in the event whereby the leadership system is not trusted by the subordinate system. Therefore, whatever the leadership asks the subordinate to do, there's chaotic because they don't even know whether what they are trying to let them do will at the end of the day be beneficiary to them or not. Now let's look at what they still are. So we say that a leadership style adopted by any leader is usually a combination of their personality. So how the person behaves as a leader includes that person's personal life, his personality, his inherent personality, the life experiences the person have gathered so far, the level of emotional intelligence the person possesses, and then the dynamisms around that person and the way of thinking. Okay, dynamism in terms of social, family, cultural, and even to some extent religiously. How this all combined together determines how the person behave and lead his people. So an understanding of one's leadership style and ability to be flexible based on changing circumstances will likely result in additional benefits. So if you understand the emotional aspect of your supervisor and you understand his personality and the experiences he has gone through in life, and the family dynamics and the cultural and the economic dynamics of his household and himself, then you are in a bit close to understanding the type of leadership styles he's likely to exhibit if given the opportunity, or he's exhibiting currently. And we say when we understand the kind of leadership styles the person is using to lead us and how flexible that styles are, then it's a high percentage of chance that there will be an improvement in communication and collaboration within the organization, because you understand why the person is leading you the way he or she is doing, not because of just from the blues, but he's leading because that is his inherent behavior. His life experiences have taught him that if you do it this way, it will give you a better result. The emotional intelligence level is so low that he cannot accommodate a certain level of criticisms. And his family dynamics are vast that it is influencing his personality, and he's an abstract-minded thinker. So when it's like that, you better understand why he may be in the imaginary leadership world expecting you to do the impossibles and not doing the possibilities. So when you do that, then you can better collaborate and communicate because you know how to go about your communication with him or her. When you also understand your leadership strategies, you increase the employee's engagement because you know how to engage him or her so that at the end of the day, you can all have what we call the participatory teamwork. Then it also strengthens the team effectiveness. And as such, leadership effectiveness become conspicuous in the organization, leading to what? Recognition. So when we do these principles, then we are closer to knowing who we are or who our leadership is made up of. So let's look at some common type of leadership styles that exist. And as displayed on your screen, these are a few of the type of leadership styles that exist. Can someone mention any of them and tell me what he or she understands by them? Anyone? Just put up your hand. Then you mention any of them that you see and what you understand by it. Okay, Loretta.
Sir, autocratic. Hello, sir.
Yes, Loretta, I'm listening.
Sir, autocratic. They make decisions on their own. They don't allow their juniors to also bring their ideas. Thank you.
She spoke about the autocratic leadership, whereby the person makes sole decisions without paying attention or without considering his followers' input. Thank you, Loretta. Yes, Prudence. Yes, yes. Let me hear from Prudence.
Please, I want to talk about the democratic leadership styles. With the democratic leadership styles,
Come again,
here
which
the
leadership style?
Democratic. Hello? Hello?
Yes, you said democratic, right?
Yes, please. So with the democratic leadership style, the leader is able to accept the followers' views and also incorporate what the followers have to say.
Oh, Prudence, we can hear you.
Hello?
Yes, we were off.
Oh, okay, then it should be the network. I'm saying that with the democratic here, the leader is able to listen to the followers and also take views from the followers, not necessarily taking all decisions by himself. Thank you.
Okay, that's fine. So democratic, he takes views from his followers. Yes, thank you, Prue. Naomi, can I hear you too?
Sir, please, transformational. That one, the leader himself, the way he leads influences the followers to do more or to listen to his or her instructions. His kind of leadership inspires the followers. Hello?
So his leadership strategy is inspiration, inspiring his followers. That's transformational, right?
Yes, sir.
Naomi, you were
Yes, sir.
speaking about transformational
Transformational.
leadership, right? Okay,
Yes,
that's
sir.
fine. That's fine. Thank you. Augustina.
Sir, please, I want to explain the laissez-faire leadership. With that one, okay, laissez-faire. Okay, I thought it's laissez-faire. That one, there is the leader gives some sort of autonomy to its followers or members, and he or she gives a little supervision to whatever they do, and also but he or she makes sure that he provides them with resources to work with, but with supervision. He's not really stern on them, and he or she allows them to do whatever they want. Yeah, like let whatever will be should be. That's kind of leadership style that
Yes.
Thank you.
I like that word. Whatever should be, should be. That is a pure definition of that type of leadership. That I don't care. I call it that I don't care type of leadership. They don't really care about anything. So whatever should be, should be. The last person, yes, Flores.
Yes, please, I want to talk about the servant's leadership style. So with this style, instead of the leader trying to exert his authority or her authority, he would rather want to serve his followers first. He always wants to make sure that their well-being is first. So he places the followers first before himself. That's how I understand it. Thank you.
Okay, that's good. That's good. Thank you. Thank you all. You all have spoken well, and I'm impressed. I think maybe I don't have much to teach again, because at least the concepts are clear, and then you have, someone say, you have hit the various nails on their heads appropriately as anticipated. So see, you say we should still learn. So let's go through them and see one by one, looking at the ones that are applicable to us as professionals and within our settings. What do we do with them? Okay. So let's look at what the democratic leadership is all about. As our sister said, it's a leadership that whereby the leader make decisions based on the inputs from his followers. So inputs or contributions and suggestions from his team members. So he is not the sole person making the decision, but he is the sole person responsible for making that decision. So get it too. He seeks the opinions of his followers. He seeks the construct, he seeks the ideas of his followers about a particular issue, but he has to make the final decision. So we say that one. It is a collaborative and consultative leadership style where each team member has an opportunity to contribute to the direction of ongoing projects. However, the leader holds the final responsibility to make the decision, and this is because of what we call accountability. In democratic leadership, one critical component of it is accountability. You must always be ready to be accountable for your leadership, for your stewardship. Okay, so at the end of the day, whatever decision you are implementing, the leader will be held accountable for the outcomes of it, not the followers, because they will tell you their opinions and ideas, and you have decided to implement it this way based on what you have gotten from them. So if the outcome is good, it's good for you all. But if the outcome is bad, it's bad for you all. But the leader, just as you will receive majority of the praises, you also receive majority of the what? The backlashes. So that is how the democratic leadership is about. The key component of it is accountability. And because of that accountability, it's allowing the leader to have the final decision-making right. Okay, so we said democratic leadership also involves the delegation of authority to other people who determine work assignment. It utilizes the skills and the experiences of team members in carrying out tasks. So what it means is that just like we have in the hospital setting, whereby the DDNS is sitting in the office and has assigned a shift supervisor who also works together with the ward in charge, And all of them, by virtue of whatever level of authority they are having, are exhibiting certain authoritative rights and command over you. So by virtue, they are also able to assign certain responsibilities to you. So that is a decentralized system. Let's have decentralized authority to the shift supervisor, who has also decentralized it to the what? The unit or the ward in charges. And even sometimes the ward in charges go further to decentralize or decentralize it to what we call what? Shift supervisors at the ward level. So morning shift has a supervisor, afternoon shift has a supervisor, and so on. So when it's like that, then they also have to decentralize it to onto the last person. And when it's like you realize that there's some level of authority over you as the ladder goes down and down and down till it get to the last person on the ladder. And this means that what? Leadership is taking place because there's so much authority that has been decentralized to the grassroots. Now, the democratic leadership style encourages creativity and encouragement of team members, which often lead to high job satisfaction. Years of by forehead corner to find out an idea to solve a problem. But you are engaging your colleagues who have also been able to idealize their concepts and share with you, and sometimes which are even better than the ideas you are thinking about implementing. And because you are engaging them, they are listening, they are hearing you, and you are hearing them. They are telling you their views, and you are accepting and also telling them your construct. They get satisfied with the job because it is not like a lead and follow team, but a teamwork. They are participatory in terms of what? The leadership and the rulings of the activities of the workplace. But the whole thing is that it has its backlash, which is the delays or time wasting in decision making. Imagine you have about 24 staff with you and you have to make a decision whereby you have to consult all these 24 staff. You can imagine the amount of time and resource you might waste in doing that. And then the amount of energy you must use to solicit their views and to sieve the chaff from the reality, because even though it is open, some others will still speak chaff, others will speak sense. And because you want to be a democratic leader, you have to accommodate and accept all and do the sieving by yourself. But in a situation whereby it will require a swift response, such as maybe a cardiac arrest situation, you can't go consulting people. You can't be asking people, okay, this guy is getting a cardiac arrest. What do we do? Kudo, Kofi, Ama. No, you have to make a straight decision based on your expertise about the area instead of doing a broad consultation. So it's not in every situation that you must always have a democratic rule. In every situation, you have to adjust to what best work. So in some situations, democratic leadership style is best. In another instance where you need to be swift in your decision making, emergency situations, rapid assessment and response system, you can be democratic about it. But in the normal, I also talk about it. And then you can also talk about the democracy of it. Now let's look at the authoritative or the authoritarian leadership style. The style that is demonstrated when a leader makes all decisions without considering input from the staff is termed as authoritarian leadership or autocratic leadership. And this type of leadership is more about negative reinforcement and punishment because you want to exhibit some punishment is paramount. Every little misbehavior, you give punishment so that they'll know that yes, you are on top of issues. And for you, you don't give a damn. You are not soft, you are hard. That's what I mean, negative reinforcement. You are trying to make people succumb to you by killing all their aspirations and hope outside your jurisdiction, that they find their aliveness and existence within your comfort zone, that you have the authority to now, because we believe that knowledge is seen as power, and therefore the person is denying you certain critical information that may be sensitive to you, to demand for your rights and your access to those information, to those privileges, then you can never be the same. You always remain under his or her authority. And one classic criteria, one classic evidence of authoritarian leadership is that mistakes are not tolerated, but blame is put in place and punishment is the reward for any unexpected decisions and outcomes and actions. So at times can be necessary to be authoritarian, even though it sounds bad, but sometimes you have to be autocratic, especially within the medical confraternity, whereby sometimes you have to be stern in protocols, so that you tell them it is by force compulsory, as someone put it, compulsory by force, that you all follow this protocol, knowing that if those protocols are not followed, then there will be disaster. Similarly to the COVID era, we were all given standard protocol. Those were authoritative leadership. Everybody must wear nose masks, PAM, case closed, non-negotiable. You must observe social distance, BAM, case closed, non-negotiable. You cannot afford to be outside your home between these hours of the day, BAM, case closed, non-negotiable. Those were sensitive, authoritative leadership strategies that were adapted at that particular time to respond swiftly to the escalation of the COVID virus. It's hard, but must be adapted at when it is critically needed, so that at the end of the day, we can all be in a safer situation. So we say that autocratic leadership can be an effective approach in cases where the leader is experienced and knowledgeable about the circumstances surrounding the decision in question, and where the decision needs to be made swiftly. So need to be made very fast, but you must be knowledgeable about it. The laissez-faire leadership, the I don't care type of leadership, is a style in which a leader provides little or no direction or supervision and prefer to take a hands-off approach. So he's only interested in allocating resources to you. He gives you the resources you need to function. He makes sure that he provides whatever resource you will need. But at the end of the day, how you will do it and achieve it is off the table. He is not bothered about it. As my sister said, he doesn't care what happens next. And these decisions are not made because these people are either new entrants into the position, or they are inexperienced leaders appointed or put in that position, or there are people that are just about exiting that office, and he seems not to be bothered about what happens. After all, I'm leaving, and what happens after I have left is none of my business. And when you meet such a leader, you can be sure that nothing will work within your facility. There will not be quality in your healthcare outcomes. There will not be change. And as a matter of proactiveness will go to a sleep. And everything about your facility will go to a standstill. And you have that organizational culture of sickness among staff. When I talk about sickness, not the mere sickness of we know, but we talk about psychological, emotional sickness, whereby staff become unsatisfied with the job they do at that current situation. So that is what laissez-faire leadership style is all about. It is a type of leadership that we don't even encourage at all, but it is there. Fortunately or unfortunately, that is the styles of some people. So we have to talk about it. Then we look at what we call the situational leadership theory and its style. The situational leadership theory suggests that there is no single leadership style that is best. You can't say transformational leadership style is best, autocratic leadership style is best, democratic leadership style is best, or servant leadership type is best. The situational theory says that it all depends on the situation at hand and which type of leadership and its strategies are best suited to solve that situation or to address that task. So what situational leadership theory means is talking about is about situation analysis outcomes. So based on your situation, you do your analysis, then you look for what best fit to solve that problem, then you get your positive outcome. So we say that since the healthcare organization faces constant change, it is important for the top tier management or leadership to encourage subordinate leaders to develop different leadership styles to manage different situations. And I'll give an example with the COVID era, whereby they have to make strategies in such a way that the greater Accra and the greater Kumasi were made to only go out if you are a critical care provider. The rest were made to be indoors and work from home, school from home, you see. So people had to make situational adjustment based on the situation at hand. Procurement processes had to be shortened because critical staffs were not coming. So you can't say you are waiting for your procurement officer to come and sign before this. No, they had to adjust the system because of the situation. Leadership structures had to be reworked on. So we say leadership style in terms of situation is adapted to manage the particular situation based on the belief that different situation definitely require different what? Leadership strategy. So the core competence of situational leaders are their ability to identify the performance level of their staffs, who can do what at a particular point in time, and what competence they have to do the job, and their commitment level to that job, so that you can fall on them during that situational period is very important. So that every manager who works in every staff of yours. And I always say that once you do appraisals and you do it well, from the beginning of the year, you set the objectives with the person. By the end, mid-year assessment, you get to know the person's strengths and weaknesses. End of the year, you avert those things so that it doesn't go into the next year. If we do appraisals very well, we'll get to know who our staffs are, what they are capable of doing and what they are not capable of doing as far as the job is concerned, their level of commitment to work. Then you even get to know who can be trusted and relied upon in situations of distress, and who, if you joke, they'll see your dirty lilies outside. The clinical nurses leaders can apply the situational approach when supervising newly qualified nurses or new nursing students, as the leaders' approach depends on the followers' level of experience and confidence. An example I gave was that if we have new students coming in, you, the in charge, have to do orientation. And with set workers, you are not doing transformational or democratic leadership style. The person is new. So what he needs at that moment is instructions to work. So you have to be autocratic. Please give patient A this, patient B this, patient C this, do this, clean here, do that. It's instructions we give. But when the person is a leveled, experienced person like us, it's like, can we discuss and see how we can solve this problem? How do we address this patient condition? It is deteriorating. What do we do about it? Do you get the concept? Do you get the difference in application, even though it is one leader, but because he has different group of followers, he's applying different leadership styles towards them. That is the principles I want you to understand. That based on situations you have, you may adapt one particular leadership style to address a specific situation or objective, and adapt another to address another one that is somewhere else. And the process is has the ability to handle change and manage different situations. That flexibility of adapting to what? Those principles. You solve those things. Buntu. You get a point. Do you understand? Then, but the loopholes, one critical thing is that focus more on leaders and not enough on group interaction. So it's looking at what the leader can do, the flexibility. So it may be seen as unpredictable, which may be challenging for employees. So if you don't understand the first concept, you don't know who to trust in terms of performance, competence, and commitment, then you face that unpredictable what? Challenge, whereby employees will become what? Resistant to some of these changes that may arise based on the situation. So as far as leadership is concerned, I made mention to you that we will be doing this more of practicality. So I expect you to have a look at this. Within your smaller groups, I want you to discuss how the various leadership styles might look like in practice, how it applies within your practical environment. Then you identify and note down the pros and cons of each of the leadership strategy. Because as we go further, we'll recall on them along the line, and then we'll discuss the details of it during subsequent lectures. So please, I expect that you do this within yourselves and you get a better understanding of it. All right, so let's do a case study. You know, I like case studies. So let's do this case study and see whether we have followed well what I have been speaking. So I have worked with a leader who recognized my strengths in organization and time management and enhanced these skills by encouraging me to take on a new role in the unit. The enthusiasm and the belief in my skills motivated me to complete my new responsibilities. Discussion question. When is this leadership style appropriate? So first of all, what type of leadership style is this? Put your answers in the comment section and then let me see. Transformational. Okay. So can someone explain why he or she has chosen the response she or she has taken so that at least we can. So someone to explain why he has chosen the answer. So who is coming to explain to me? Explain to all of us why you took the answer you have selected. Oh, nobody's explaining to us. Or I should just call anybody. Okay, okay, Lydia.
Sir, please, I chose. Okay.
Lydia.
Sorry, please, my network wasn't stable. I chose the transformational because I learned that with the transformational, the leader likes to empower his followers. And with the case study you gave, he said the leader recognized the person's strength in the organization and he's encouraging the person to do more. That's why I choose that one, please.
All right. Okay. Thank you. That's why he chose them. He chose transformational because it encourages them. All right. Anybody else? Deborah?
Hello, sir. Please, I will choose democratic and transformational, both of them, because in democratic, you are allowed to do whatever you want. So in this situation, the person is allowed to do whatever he or she wants in the workplace, and at the same time, transformational because the leader empowers the person to or encourage the person to do whatever that is right that the person is doing at the workplace. So that's why I'll choose democratic and then transformational.
So if we were to choose one, the space is just for one response. Deborah, the space is just for one. Which one would you have gone for? Which one best fits? Yes, the two are right, but one best fit the case scenario.
And then I'll choose democratic.
Okay. No, noted. When I explain, we will see. Yes. Whether transformational is wrong, autocratic is wrong, democratic, we will see. Yeah, Augustina chose democratic. Yes.
Sir, please, I didn't choose democratic.
Deborah
I
chose
chose
democratic.
transformation.
Augustina, you choose transformation, right?
Yes.
Okay, tell me why.
And in your earlier submission, I don't know, you brought a table that explains transformational to be having 4 qualities. It's like transformational. It coaches individuals to develop their future, and it also motivates people like the subordinates and then the how do you call it, the followers. So the table that we explained earlier, I don't know whether I got it, but per that one you mentioned that transformational it coaches and is kind of authoritative at some points and also democratic at some point and affiliative at some point. So since it have all these 4 qualities, and per the case study that you just posted, I think transformational is the answer. Thank you.
Thank you. Thank you. So I think I'll just close with Augustina because based on the principles or the construct of transformational leadership, yes, democratic leadership is a sub-domain under transformational leadership. You can't exhibit transformational leadership without having democratic style inside. So that is why I said that one is a bigger one. So transformational leadership is actually the more prominent being demonstrated here. Because if you look at it, the staff is interested by personality. He's using his personality to influence that of his what? His follower. And that is by asking him or her to take up roles and responsibilities that will build his or her talent. Okay, so let's look at the next one. So we say the answer is transformational leadership. Okay, so let's look at this one. This one too says that I have worked with a leader, Dada's leader, who was considered by some team members to be harsh and upfront. However, she will reward tasks completed to a high standard by being pleasant for the rest of the shift. He was good at issuing orders and getting work done, and she commanded what? Obedience from all staff. What type of leadership style is this? Okay. Can somebody also kindly explain to me why he would choose a particular answer? So let me hear. Let me get some feedbacks or responses. Why you would choose. Yes. Is somebody telling me why he or she have chosen a particular response? Okay. So when you let me just, based on your response, I'm seeing authoritarian, and then transactional as dominating. But let's look at it from this perspective. Let's look at the preamble again. Who was considered by some team members to be harsh and upfront. However, she will reward taxes completed. You understand? She will reward taxes completed, meaning this is a leader who reward what? Effort. In the authoritarian leadership, we said negative reinforcement is what dominates. It doesn't reward good. It only punishes. That's authoritarian. But transactional will reward you for good and punish you for bad. So if you look at the middle of it, it speaks more of what? Transactional leadership instead of what? Authoritarian leadership. They are always a bit similar, but there is a unique characteristics of each of them. And then so for that, we expect that you have to take time to understand them and know what they are made of and what each of them constitute. Okay, so let's go on. So for your own self-assessment, I do expect that once after this lecture, you go and sit and ask yourself these personal questions to see where you belong. So do you personally have a tendency to use one leadership style over the other? If yes, which leadership style is your dominant style? And which leadership style do you use the least? And why do you do that? Why do you use? This is self-assessment for you to do. Now let's look at effective leadership behaviors in maternity care. And that will bring our lecture to a close, and then we can call it a week. So effective leadership in maternity care is important because Evidence have shown that it is associated with reduction in medication error and hospital-acquired what? Infection, because when we look at the roles and responsibility or the duties of a midwifery leader, we said one was to prevent infection at the fertility level, and then patient safety, as well as enhancing what? Care. So if you do those ones very well, and you are an effective leader because you have implemented them, then we should see reduction in medication errors and hospital-acquired infection. And 3 out of 6 studies have shown that what? Effective leadership within the maternity confraternity is associated with what? Lower patient mortality. So lower maternal mortality, lower neonatal or perinatal death rate. So you see that our perinatal and mortalities and then maternal mortalities reduces. Okay. And if we are effective in our leadership, it's also associated with patient satisfaction because they get the joy. The mother delivers and get the baby, and they are both healthy and they go home. So all of the parties involved, satisfaction. You understand? But what are some of the characteristics that define effective leadership behavior? One of them is clear communication. Your ability to communicate without being ambiguous. Your ability to communicate with someone without being ambiguous is very important. So we talk about what? Clear communication. Then we also talk about ethical decision making. You must be the professional type who is the leader. So you have to stick to the ethics and the standards of your leadership. Okay, so you have to be ethical in your decision making. You have to be professional and be stern and steadfast with whatever you are doing as a leader, taking into cognizance that there is a tomorrow. So what you apply to A, expect the same to be applied to B when it comes. If you know you can't do that, then don't do it. Then emotional intelligence is very important. You must be able to balance your emotions with work. So effective leadership has a very good control of emotions. He's accountable. Accountability is an act of effective leadership being demonstrated. And the last is what? Mentorship, professional role modeling and mentorship. Coaching and mentorship, very important. Because you need someone to succeed and continue with the good things you are doing as a leader. And for that reason, you need to mentor and coach people appropriately. So we say that what evidence from other studies have shown that what transformational leadership is one of the leadership that is very, very efficient within the healthcare system because it was identified as a positive contributor to safer climate. Climate because not the atmosphere climate, but the work culture, the organizational culture, because it gives people the opportunity to air themselves and be heard and their inputs considered in decision makings, which was applicable to their job descriptions. Then lower turnout because everybody get the opportunity to work better. Then there is a great favor by nurses related to intrinsic motivation and job satisfaction. Unlike the laissez-faire leadership type, who seem better within the social construct of this work environment because it leads to what? Laziness amongst us because leadership is poor. So evidence have also shown that nurses appreciate inspirational motivation and idealizes behavior influence because whatever you do, you want it appreciated to the best of your abilities so that you feel entitled because you have done your best and your best has been appreciated, but not the other way around, that you do your best and then still the system doesn't recognize your efforts. It's very demoralizing and can be very, very, very devastating. All right. So by virtue of this, we come to a summary of what we are talking about. And we say that there is no one leadership style that is correct. Every leadership style is dependent on the situation that you are handling or the objectives and the target you have set to achieve. So we say that think of leadership styles as different golf clubs. So those of us who play golf clubs, you know what, a golf game, or watch golf, you understand what I'm saying? You pick a club based on the shot you need. So you pick the situation, you pick the leadership style based on the situation at hand. Okay. And then we say effective leadership behaviors improve what? Maternity outcomes. We cannot do leadership styles without looking at emotional intelligence. So I want you to go and read and understand emotional intelligence in relation to leadership in the health sector. This construct or concept is very important as far as leadership of this century is concerned. Emotional intelligence is very important, and I would like you to read on it, and not just read on it, read and understand the 4 cardinal domains of emotional intelligence and how each of them is related to your style of leadership. On this note, I bring my lecture to an end, and I'll recommend that you also read ahead of next week, Communication and Interpersonal Skills, whereby we'll look at effective communication in healthcare settings, team communication and collaboration, communication with patients and families, reporting and handing over and documentation. Thank you for your attention. Any question, comment, suggestion, or discussion? So the last time I spoke about videos and those things being on, can we control them? Thank you. Are there any questions, comments, suggestions? Anybody with something to share with us based on the lessons of today? Okay, Sister Gifty, please. I think you can speak. You are muted. You have been unmuted. Yes.
Okay, sir, good afternoon.
Okay, so
Please, my question is, my own is a question. Please, my question is, the type of a leader, where will you be classified? A type of a leader that, like, let's say you will be harsh or authoritative on your staffs or your subordinates. Then later, when the right thing is done, you apologize to them. Does it fall under? Yeah, not necessarily harsh per se, but you want the right thing to be done. But if you don't put pressure and if you don't authorize them, but after the thing is rightly done, then you go back and apologize to them and talk to them that, like, you were sorry, it was because of the work.
So that's why
you were being harsh.
Yes. So that is a situational leadership style, because he has adapted autocratic rule at that point to solve that problem, that situation. But after that, he reverts back to what? Maybe transformational leadership, or he reverts back to what? Democratic leadership. Yes. So it is situational at that moment because he's adapting autocratic, because that is not his leadership style. But because he wants to get that job done, he must give directions and directives. Okay. And when that happens, you would definitely have to revert back to your old leadership strategy, meaning that you only exhibited a situational, based on the situation, you adapted that strategy.
Okay. Thank you, sir.
Are you okay?
Yes, sir.
Anyone else? Are there any other clarity to be given? So I believe by the close of today, we have achieved our target. At least we know what some of the leadership theories are. We can even analyze our current leadership structures to see how they behave, why they behave that, and what are the expected outcomes outcome based on that behavior they are putting. You understand what I'm saying? And then we can even go further to look at ourselves within our social environment, our cultural environment, our domestic homes, our workplaces. We exhibit leadership. What type of leadership am I exhibiting? And at the end of the day, when I do this thing, what do I expect in return? Because every leadership style has its kickback. So do I get what I'm supposed to get because I behave this way? Or my people are also misconstraining me? And if that's the case, then you have to sit up and do the needful for everyone to be on the same page. On this note, I thank you for your time and for listening. And I pray that we'll meet next week, God, in good health and sound mind. Thank you and enjoy your week. Bye.
Thank you, sir.
Bye.
Bye-bye.
I have an